Okay, so my name is Bahman. I'm one of the lead coordinators here, part of the research team at Sean and Parker, Stanford University. And today I'll be presenting on eczema and food allergy at the Ask the Expert webinar. At the very end, we'll open to some Q&A or throughout the presentation so that hopefully I can respond to some of them or all. And if the time does not permit, then we could follow up with those questions later. Okay. For today, we'll go over what atopic March is, and how it relates to food allergies, just touch up on eczema and atopic dermatitis as it fits into atopic March and food allergies, interventions to prevent atopic March, highlight some clinical trials, and open up to Q&A and go over those questions. Okay, so atopic March refers to the natural history of allergic diseases as they develop over the course of infancy and childhood. This figure is presented here. It just shows the prevalence, how the prevalence of atopic dermatitis peaks early in infancy, opening the doors to consequent development of atopic March. Development of food allergy, asthma, and allergic rhinitis in the young toddler age group is common after the cutaneous manifestations. Next slide. So here's a just overall diagram of the proposed atopic March pathway from childhood eczema to asthma and or allergic rhinitis. As you can see on the left, early onset eczema is more closely associated to asthma and allergic rhinitis than food sensitization and wheezing alone. And childhood eczema could initiate by genetic predispositions or environmental risk factors. And then you've got environmental modifiers that affect the pathway to asthma and allergic rhinitis. Some of these environmental modifiers such as daycare, animal exposures, and these all could lead into kind of the atopic March and continue on the atopic March process. So defective skin barrier that could lead into cracks in the skin or not the best barrier to the allergens outside. It could lead into epicutaneous sensitization, which could initiate the Th2 memory cells to nasal and bronchial lymphoid tissue. And these could lead into sensitized airway and airway inflammation, which could result in asthma and or allergic rhinitis. So this there's some studies that's come up that are looking over the prevalence of eczema and the comorbid allergic diseases surrounding it. And these all fit into the type of the discussed atopic March. So study done in 2016 looked over a study done over a nationwide web survey in 2016. They found out the duration of breastfeeding, season of birth, pet ownership, household income, and the number of siblings were associated with the prevalence of childhood eczema. The prevalence of the current eczema was 13% among this group. And among these current eczema, they're most significantly associated with wheezing, the prevalence of wheezing, rhinitis, and food allergies. Next slide. Okay, so here we've got just an overview of eczema biomarkers and how we can determine some of them and some early onset of eczema or see them in biologically and biomarkers. So on the left graph, you can see the early onset of atopic dermatitis or eczema, including the groups 1 and 2, that they demonstrated significantly higher serum IL-13 levels in compared to the control group. So those who would have early onset of atopic dermatitis, you could see elevated serum IL-13 over the compared control group. And on the right side, you can see that there's no significant differences in serum thymic stromal lymphoproteins, so TSLP, in either groups comparing to control group. So to kind of prevent atopic March, we first need to understand the causes to enable the prevention. So just for example, if diet such as fast food or foods that have a lot of preservatives, pollution, smoking, or chronic antacids can increase the risk of allergies and enable the atopic march. We also have things that could prevent it or help prevent the atopic march, such as a diet that consists of fresh produce and a Mediterranean diet that consists of variety of different foods. If we've had enough vitamin D, being around pets at home or animal farms, things that could enable better microbiome, GI microbiome, they could all help prevent these atopic march that could lead into food allergies and other comorbid allergies conditions. So in this next graph, we kind of have a kind of algorithm that Grimshaw in 2017 constructed. This algorithm for allergy prevention consists of 3 stages that starts from before sensitization to the food allergen. So the first one is primary prevention, which is prevention of allergic diseases in individuals who do not immunologically are sensitized. They're not immunologically sensitized to the foods. And if sensitization has occurred, then you have the secondary prevention, which is prevention of the development of allergic disease or the atopic march in individuals that are already sensitized. And if the disease is already manifested and progressed, then we got the tertiary prevention, which is the treatment of allergic diseases, which then if we did not prevent, then we would have the allergic diseases done. Okay. Sorry. Okay. So here we just have an overall look of how the skin barrier function and allergic diseases are related. So from here, if dual allergen, vitamin D deficiency, or hygiene hypothesis, they all lead into this kind of graph we'll put together. So the hygiene hypothesis is that the more kind of bacterial that someone is exposed to, the less hand washing or the less routine or less aggressive detergent used could have created better tolerance than if there's a lot of these kind of hygiene has taken the precedence over the life and reduces these good bacteria from entering the body and preventing some of these atopic march or comorbid allergies. So sufficient levels of vitamin D, diverse microbiota, and oral allergen exposure collectively support the development of tolerance. Conversely, allergic sensitization is promoted through cutaneous exposure, reduced diversity of microbiota, and vitamin deficiency. Diminished microbial diversity and vitamin D deficiencies are thought to interrupt the regulatory mechanisms of oral tolerance, with the latter also contributing to decreased epidermal barrier function. Okay, here I've got a busy slide of the kind of first primary prevention method of atopic march, which is the barrier enhancement. And in here as we discussed, eczema is the earliest onset of atopic march. So having a barrier function, having a barrier enhancement could stop the atopic march or prevent the atopic march from progressing. So studies have shown that regular application of emollient prevents the onset of infantile eczema. In a group of infants born to atopic families, preventative application of emollients, soap avoidance, and a mild cleanser resulted in a 50% decrease in the predicted rate of eczema at 1 year. And this is 15% as compared to 30% participants that had more eczema or risk of eczema. Another study was the ceramide dominant physiological lipid-based emollients, just serum, osmotics, US, and Epiceram, Pura Cap. Some of the brands out there have also been shown to significantly improve SCORAT, which is a scoring system for eczema. They reduce transepidermal water loss or TUL and improve stratum corneum integrity and hydration. Recently, the BEEP or barrier enhancement for eczema prevention randomized control group study showed that preventative emollient therapy from birth reduced eczema at 6 months of age in high-risk newborns from 43% in controls to 21%. So there's about over 20% decrease in eczema at 6 months of age. In another study recently published, preventative emollients therapy in high-risk infants reduced eczema at 6 months by 32% and improved the hydration in the lower limbs of the skin. Okay, next one is the second step, or another method of observing the reduction or the primary prevention of atopic march, which is the reduction in environmental food allergen exposure. Studies have shown that regular application of emollients prevents the onset of infantile eczema in a group of infants born to, actually, this might be the wrong, okay. Yeah, so for the reduction of environmental food allergen exposure, environmental exposure to peanut antigen measured indirectly by household peanut consumption is associated with an increased risk of peanut allergy. Peanut protein in household dust is positively correlated with household peanut consumption and is biologically active. Even nanograms of protein or peanut protein in dust extracts are able to stimulate basophil activation in whole body or whole blood from peanut allergic patients. So even the exposure to the dust in peanut proteins could induce an allergic reaction in those who are allergic to peanuts. In children with eczema, increasing environmental peanut exposure in the home increases the risk of peanut sensitization and allergy. So that's one of the studies found this, that if you have peanut protein at home and if they're not exposed to it early with some underlying conditions of dry skin or eczema, the peanut can enter through the skin and cause reactions and develop food allergies to those foods. Okay. Next slide. Okay, so secondary prevention of I'll just go over this really quick. So secondary prevention of atopic march or the treatment of atopic dermatitis. So in case where preventative emollient therapy is not successful in preventing eczema, we anticipate our interventions will still reduce the severity of eczema. However, in those children who still have eczema flares, it will be important to manage those flares proactively. Preventative weekend therapy applications of fluticasone, propionate reduces the eczema flares and is not associated with new skin thinning with treatment of up to 16 weeks. We will advocate a similar prophylactic treatment strategies in infants with recurrent eczema flares. I can stop here briefly to see if we go over some of the questions and see if we can get some responses while time permits.
Bahman, there's 2 questions in the Q&A panel. If you want to read them.
Yeah, absolutely. So Marina has asked, does proposed pathway mean this is still a theory of these connections, or is it fairly well established? Okay, so obviously more and more studies are coming up more recently, and a lot of things, while we understand and we have found a pathway to or have found an answer to, they could still be debunked or more informations are added. So when we say proposed it means that it has been suggested by studies, it's been observed by several studies and in large controlled groups or trials. But obviously more studies as they come up, since this is all recent and it's leading the field, there could still be a lot more that adds to this pathway. So yes, by proposed, we have seen it in studies, we have seen it in practice and experiences, but there could still be more to add to them. I hope I've answered. And then in the prevention or aggravator factor slide, use of antiacid was a negative. has that connection, go back to it. Okay, has that connection been established? Okay, our child has had supplemental Tums consumption daily prescribed as calcium source. I would leave this to one of our clinicians. I'm not sure if we have Dr. Cinder or Dr. Fast or anybody who would like to chime in here to have a more clinical, at least experience to include. Do we have? Okay, well, I could follow up on this, if that's okay. So we can.
Yeah, so sorry. Bahman, did you have a question for me? I was dealing with another.
Yeah. Well, yeah, I'll just read over the question. So one of our participants asked, or attendants asked, in the prevention, or the slide that I will go up to. So in this slide that we have of the kind of understanding the target intervention for atopic dermatitis, it says in the prevention or activator factor side. So things that include or kind of lead on or increase the risk of developing any kind of allergy.
Yes.
Acid was negative. Yeah.
Yes. That's an excellent question. It is what we, I think the question was specifically about Tums, right?
Correct.
But in terms of, because some of our patients are on chronic proton pump inhibitors and H2 blockers, and usually that, all of these are kind of, none of this is like, no, it's not like every person who has gotten an antacid is at risk. It's just different kind of signals we've received when large amounts of data have been looked at, and none of this is like definitively established. And these are just hits. And so that is something we toss around, just being on chronic H2 blockers or PPIs, if that affects allergies. In the past, there have been a signal that it contributes towards it, but it's hard to know, is it the medicine that's triggering it, or is it something about the person's GI system, something at baseline that's requiring the need for antacids that also puts them at risk. So I know that's a very long-winded way of saying we don't know, but I'd be very careful about being definitive with these associations, because at the end of the day, quality of life and kind of addressing the issues we have at hand are super important. An example I would give is, overuse of antibiotics are often used as an example of kind of destroying our microbiomes and how that can lead to risk of allergy. But I will tell you, if there is a severe risk infection, you need antibiotics. So I would never not prescribe antibiotics because of the risk of allergy. I don't know if that makes sense, but just being mindful that all medications have risks, but if we need to use them to treat the condition at hand, it's also very important.
Great, thank you, Sutina. Okay, so we have another question that from Naga. I hope I pronounced it right. So my son is 14 and he has severe eczema and food allergies to peanut, tree nuts, dairy, egg, wheat, and many other foods. Like peanuts, does other allergens go through skin barrier resulting in eczema? So from what I know, peanut has been studied the most. It's one of the most prevalent food allergies, and that's what has been studied the most. And it's one of the potent nuts that induces allergic reactions that could often be anaphylactic or hit several other systems. So these studies have thus far looked into peanuts, and there are several other studies that have looked into many other allergens, but at least in treatment of it or in prevention of it, as far as testing the foods when we have better skin treatment. I think the science is a little behind on this, and hopefully soon to connect with other food allergens. And but at least with peanut or with egg, wheat, or dairy, more often those who are are allergic to it grow out of it, and peanut kind of persist. So we are in need of more studies, more controlled clinical trials to study this, to have a better answer. Okay, so we have Inhok who's asked, it might have already been explained in the previous slide, but does early exposure to soap and cleansers increase the likelihood of eczema in infants? I think the answer to this is kind of rewording of the same sentence. So I think doing more hand washing or using more aggressive detergents and more routinely washing the bed sheets or covers, or things that are at home, kind of reduces the exposure to the bacteria that are around the house, reduces exposure, so that if those who have eczema could benefit from. So as in, if you have eczema, having less proteins floating around or less antigens around could be beneficial and reduce the chance of eczema. Whereas if you don't have eczema, then being introduced to these could be better. If you don't have eczema, being introduced orally would be beneficial.
Yeah, and I would thank you so much, Bahman. And I'd like to add to that as well. And this is Tina Cinder again. This is actually like a little bit twofold in the sense that what Bahman said is absolutely right. You want to reduce the, anyone who has dust mite allergy, we say you got to wash your sheets more frequently. There has been studies showing peanut protein is found on bedspread, so washing them frequently is very important. But there has also been a link with detergent use and the disruption of the skin barrier. So this is again something that a lot of experts in the world are actually actively looking into and trying to understand what are the components of these kind of strong cleaning products, dishwashing liquid, hand soaps, detergents, things that are so good at getting dirt off our things, are they also actually just kind of disrupting our barrier? So this is under active research. But what I tell my families who have dry skin or eczema is trying to do, second rinse if possible, and definitely emollients, lots of creams, and kind of being aware that a lot of detergent use can actually have the opposite effect of actually, hurting our skin more than helping.
Thank you, Dr. Cinder. I have one last question in the chat box, and I think we'll take this last question and then we can end the webinar today. It is a patient, or not a patient, sorry. One of the attendees asked, if they have a food allergy, but they're not certain, what it is, should they stop eating it, eat it in moderation? And then recently, they've been eating something they weren't aware of the food allergy, so they're trying to determine what the food is. So how would you go about that? And what would be your suggestion?
I definitely think if there is concern for food allergy, to get tested with an allergist. And the reason is that there are, with food allergies, yes, oral immunotherapy and kind of slow desensitization is a process, but it takes a lot of like supervision and guidance. And our worry is that if someone is truly allergic, they can develop severe life-threatening symptoms, sometimes out of the blue, depending on how much exposure they've had. So I would not recommend kind of trialing and error and continued exposure if there is a specific food that's suspected, and definitely needs testing to prove kind of what's going on.
And then I think Bahman's gonna share the last slide where you can contact us with any questions. This is a slide where if you want to go back one, Bahman, is a puzzle of all the clinical trials we do have in the center. If you want to add anything, please go ahead, Bahman.
Sure, yeah. So just to summarize, I think one of the few things that we touched on here as kind of prevention of eczema and proactively taking care of the skin and creating a skin barrier could kind of prevent the atopic march, which could lead into food allergies that a lot of people are interested in, a lot of people suffer from. So of our center, we have several studies that target kind of different stages, different allergens, as you can see, and kind of put together a puzzle piece. One of our studies that's recently activated that focuses on creating this skin barrier from participants that are up to 10 weeks of age or 12 weeks of age to be soon. Participants will be using, or could be randomized to groups where proactively use skin emollients that could create a better barrier and see if this has an effect on reducing the risk of developing food allergies. But here has an overall look of all of our other studies. And then we have this slide, the contact information for those who would like to get in touch with us. There's several great links here that you can follow through and see our studies and see our personnel. And if you have any other questions, you can definitely let us know.
Bahman, I do have one here regarding that puzzle you were talking about. Someone had asked the MAGIC study, has it started recruiting yet? And they're hoping to participate. So if you can answer that one, the other questions, I will email and contact you guys.
Yeah, absolutely. So yeah, so MAGIC study has undergone, but it has not activated yet at this site. It has more sites that are outside of California, and they're starting theirs. And we're looking forward to opening it this fall. So in the next few months, we expect the MAGIC study to get activated and start recruiting. And I will definitely get the contact information. I think, Marina, if you want to get in touch with us using your links or follow on our center, and I could get you in touch with our coordinators or put you in touch with the study team.
And then Bahman, can you share that last slide again where they can get more information about the studies and who to contact? Thank you, everyone.
Awesome. Thank you. Thank you for joining.